Just wanted to check in with you on how things are going with the Multicultural Center and what your needs might be.
Yes, we do work with an incredibly vulnerable population, even without this pandemic happening. But we are also blessed because if we work with a group of people that are incredibly well adapted at surviving. So even in the harshest of times, which many of them have lived most of their lives in incredibly harsh environments, are resilient, are very tough. They rely on each other a lot. The problem here that we're facing is communication. It's very tough without having that personal one-on-one and one in group contact and being out in the community to keep those messages, important messages, moving through the community. We don't open up our office right now. It's only by appointments. So if someone comes in, we're able to assist them. But even the client I just had, it was just endless questions and concerns and doubts. It's unique for us because we can't rely on those traditional means of communicating. So we know this week's going to be a challenge because a lot of panic is going to be setting in. Having kind of 1 week was tough, getting kind of through week 2, but now week 3, all those real issues, bills, no work. Clients felt like, oh, they're going to get through it, but all of a sudden they go through a week of no work, and then, yeah, that vulnerability really gets exposed. So we know the worst is ahead of us.
We all, some of us expect a $1,200 check to be deposited in our bank account. I suspect for some of your clients that won't be the case, and yet they will still have to find money for rent. They will have money for food.
Yeah, we're very used to working with clients that don't get any handouts from government, aren't eligible for rental services or electric bill services, won't be eligible for this relief check that comes. So a lot of our clients do live kind of a binge and purge type of lifestyle with their finances. Obviously, right now is when most of the employment for a lot of our workforce begins. So they're getting out of that kind of purge from the winter of really, paring down on their expenses and getting through the winter with the little savings they had, waiting for this month of March and April to really get into the workforce and get going. And it's not happening. We do have some emergency funds. We can work with other partners for, individual type of instances. We hope it doesn't become a pandemic here with not being able to pay expenses, but we've built relationships with landowners, landlords. We'll see what we can do in terms of communicating with everybody that maybe if we all work together, not the best for everybody, but we can find a best way out to manage the next few months.
How about in terms of healthcare?
Yeah, so healthcare has been a huge obstacle before this. We've been really working well with our partners, the main one being Chop Tank Community Health, to encourage everybody to at least be enrolled. They have what's called a sliding pay scale, or sliding fee scale, so people can pay a reduced price for their services without having health insurance, but making sure that they just have that primary care doctor. Because now we get a lot of phone calls where people want to go to the hospital on instinct. And of course, this is not the time or place to do that. So when they can't get treated at the hospital, they even get more worried. But we've seen this time around a lot of calls are when we ask, well, are you enrolled in Chop Tank? And they can say yes, then we can quickly get them to just communicate with their health provider. So really, again, communication's our big one. So as much as you can feed us information, we can get it translated to Spanish at least and get it out to the community in one form or the other.
Thank you, Matthew.
All right, thank you, Dave.
Talk to you soon.